welcome to the Fit and Healthy Today show. And our topic matter today is on Lyme disease. As always, I had a few people walking in with this, and it's not super duper common yet, but it's seeming to become more and more common, and I'll explain the reasons why. Lyme disease is the most common tick-borne illness in the United States, and it primarily affects, in the United States, the western United States. It is passed on most of the time by deer ticks in their early stages when they're very, very small. And they carry a bacteria, spirochete bacteria, that when they bite you and they latch on, it puts this bacteria into your blood, and it seeks out and stores, or tends to store, according to UC Davis, in the lymphatic system, and it hides out so that it can replicate and modify. Now, when a bacteria gets in the lymphatic system and the body can't identify it because it's not completely in the blood, then it's very difficult to eradicate. What's interesting about this disease, since it's a spirochete, is there are other diseases when we run the testing, and I'll talk about that later, that are very similar in symptoms to Lyme disease. Now, generally the symptoms, and this is real general because they can vary from person to person depending on how immune compromised they are. 50% of the people that came down with active infected Lyme disease were very immune compromised before they got Lyme disease. So the body can't detect the friend from foe. So the symptoms, basically, as I've listed here, run in stages and severities depending on the immune system. Within 3 days to 3 weeks, 60 to 70% of the people will, when they have been infected with Lyme's and their body's not fought it off, will have like a small raised bump, and it oftentimes looks very much like a target. If you ever have that appearance on your skin, you get to the doctor immediately, because this particular spirochete, like syphilis and other spirochete-based bacteria, is treatable with antibiotics if caught early. May also give you the fever, chills, nausea, diarrhea, body aches. Now, further on down the road, a few months later, and some people a few weeks later if it progresses, but generally a few months later, you literally can get nervous system issues, particularly in the face, with symptoms that kind of resemble Bell's palsy, where you get that numbness on one side of the face. And anything that's electro or nerve related, like your heart rhythm or nerves in the limbs, can go funky on you. More advanced over the long term, and 10% of those with Lyme disease develop these particular more advanced symptoms, which are really severe roving arthritis types of symptoms. They're kind of like having a chronic fibromyalgia or chronic arthritis that roves and moves, but you'll have good days and bad days depending on how good your immune system, whereas arthritis or osteoarthritis particularly goes to one or two joints that have been used or misused. This one can travel all around the body. It's very difficult and can be very confused with some other arthritic or other types of diseases, including chronic fatigue syndrome, I'm sorry, I misspelled that, gout, lupus, and multiple sclerosis. So we're not sure whether or not some of the people who've been diagnosed with MS may actually be fighting Lyme disease. You have to have a thorough test to determine, and it's not 100%, because some of these other disorders of the immune system can show very, very similar results in the testing, because there's really no specific, gee, you have this spirochete in your blood, because remember, where it hides is in the lymphatic system. So it's the immune response that we look for. I wrote down, and I thought it was kind of important to point out the various tests that are done with this, and I think it's important to know that all of these tests need to be performed, because some doctors will only do IgM and you'll get a negative and you are actually positive. And this has happened to a couple of my customers. So it's important that the doc runs the IgM, the IgG, and the Western blot test. Now I've written down in format what is and what the results would be of that, so you might want to take note of that, or you remember our shows on youtube.com/VHFILM, so if ever you suspect you might have that, be sure that your doc performs these tests. Sometimes they'll just do the IgM or the IgG and they won't do the Western blot. Get them all done. Seriously. Now, where the problem lies is when you get a negative IgM and a positive IgG and a positive Western blot, because what that means is you now have the more entrenched infestation stages, and this late infection is very, very difficult to fight, and the antibiotics are not very effective at this point when it's gone throughout the body for this long of a time. So it's very important, once again, I have to repeat, to do the antibiotics, particularly with early detection. Now, when you're doing the antibiotics, it's very, very important to remember that you do a broad spectrum probiotic. Okay. And some of these, since I have time, I want to go into a little bit of detail as to how these work and if you think it's appropriate. Now, antibiotics go through when you take, and mind you, some of these infusions for Lyme disease can go on for weeks or months. So it literally can destroy a good portion of your immune system in the process of trying to destroy the spirochete bacteria. So it's very, very important that you do a broad spectrum probiotic with a minimum of 20 billion good bacteria per day. It would be my inclination that you do 50 billion, probably twice a day, but most of the studies bear out this particular figure. They build the good bacteria, and remember 80% of your immune system is in your bowel, so in order to be able to fight off this infection at the same time as the antibiotics are killing it, keep the good bacteria up. Make sure you're taking a good multiple vitamin, because remember how I said earlier how 50% of the people were already immune compromised and a good portion of them were on immunosuppressants, steroidals, allergy medications, which are immunosuppressants, because they're out in the wilderness in the wild, and guess what they're doing? They're doing their allergy meds. So allergy medications suppress the immune system, and then the tick bites and it goes crazy. So the body doesn't have a chance to respond to it in its early stages. So a good multiple vitamin, and then always with a little bit of C, particularly if you're into outdoor activity, 1,000 milligrams twice a day. You need that for your connective tissue anyway. But if you do or have a continuing Lyme disorder, then you need to keep ester C, 2,000 milligrams 3 times a day. Now, most docs don't understand that when your immune is under attack, your body's requirements for vitamin C raises substantially. So doing this buffered form of vitamin C aids and abets your killer T cells to make good quality killer T cells, and aids abet other things as well too, the cells to fight off these bacterial infections. Now, this is a very well-researched beta-1,3-glucan, and actually, pharmaceutical-wise, it sells for over $190 a capsule. But what beta-1,3-glucan is, and you're going to find it in some of the fancy maitake and shiitake and some of the other mushrooms, but typically it's made, or generally it's made in a commercial arena from the cell walls of baker's yeast. And what it does is it goes into the body, the spleen and the lymphatic system, and where you make your killer T cells in the spleen. What it does is it makes them Navy SEALs instead of producing a whole bunch of fighters, so they have a better ability to identify friend from foe. And so as these killer Ts are traveling out through the body, they can detect and destroy, isolate and destroy the bacteria. Very well researched. We call it the Russian antibiotic is garlic. Now, garlic is an antimicrobial, and it works, we know, on respiratory infections and colds and things like that are microbial based, kills parasites. I don't normally mention a particular product, but in this case I am, because the high sulfur content really makes a difference in being able to help the body respond to this spirochete bacteria. So keeping garlic up, you can either do fresh whole garlic, throughout the day, if you want to be stinky and smelly, or you can do the Kaolic Reserve, particularly as a deodorized garlic, and it can help once you have the Lymes with hopefully keeping the infestation from, going and coming. Savantaro, cat's claw, has quite a bit of immune and actually some cancer research, and it has quite a bit of research, or I should say some research on Lyme disease as well, as far as preventing the spread and keeping it under a controllable, See, once it's in the body for a long time, the only option we seem to have is to keep it under control to where you can live your life in a normal pattern and pace. I've known people, and I've had 2 customers that have passed away from Lyme disease, or the side effects of Lyme disease. And so it's something to be taken seriously. So what I'm mentioning here is not just doing 1 or 2 of these things, but you really need to attack it from all different angles. Lymphatic cleanse products, and later on in the show I'm going to show you a lymphatic exercise that helps move the lymph along and flush it out. But there are products that are called lymphatic cleanses, and what they do is they flush the lymph, they thin the lymph mucus, and as a result then the lymphatic can move itself a little further. And remember, these things hide in the lymphatic system, so you want to push them out as best you can. So doing lymph cleanses are very, very helpful. Antioxidant formulas, particularly with A, C, E, selenium, and zinc, because once again, immune system stimulators, and it aids the body in being able to fight off the infection. Diet, and I refer to our website, youtube.com/VHFILM. The diet is very typical of what we would find with lupus or arthritis. We like to alkali the blood, lots and lots of greens. We avoid sugar, white flour, pasta, starches, as much chemicals as we possibly can, because remember, those chemicals bring down the immune system. So as much raw fruits and vegetables as you can, keeping the proteins very lean proteins, and adding in good nuts, walnuts, almonds, pecans, fish oils, those essential fatty acids. And there are some studies on essential fatty acids in limes. I didn't mention it on here because of the room factor, but those essential fatty acids help you deal with a lot of inflammation, whether it's lupus, arthritis, or Lyme disease. Finally, I'd like to conclude, these other diseases that I list here can give you false positives. So it's interesting. So syphilis, mononucleosis, HIV, they can also give you false negatives. So if you have these issues, especially mono. Now see, mono can completely throw off the test. So if you have mononucleosis, your IgG is going to be completely thrown off. So it's really important to rule out these other disorders in addition to trying to detect the Lyme disease. Anyway, that's it in a nutshell. Next, we're going to be moving on to the fitness portion of our show. Thank you. Hi, welcome to the fitness portion of our show. And since we're talking about immune compromise, and I'm seeing so much flu coming into my store already now, I thought I would review an exercise that I kind of bring out in the winter time that's real good for moving along the lymphatic system. And since, as we noted previously in the prior section, Lyme disease hides in the lymphatic, it's real important that we move the lymphatic system. Anytime you get sick, and I'm telling you, even if you get pneumonia or any types of viral infections, you've got to move to some extent. And I think that's why some of the studies supported that 30 minutes of exercise when you're even just not with a fever but slightly ill can move that lymphatic system and sometimes bring you out of being sick. So what we do in this particular movement, and we've got a whole body shot here, so this helps us, is we want to move in the lymphatic system. You can feel it. You know how sometimes when you get sick, you get a little swollen here, or you get a little swollen here if you get a respiratory infection or a breast infection, or you get in your inner thighs, you'll get a little swollen here if you get a lower extremity infection or bladder infection or divers. The lymphatic is where the body dumps all of its used white blood cells and waste materials, and then it flushes out of the body. So it's real important that we aid and abet the body with movement. So sitting in bed or in a chair more than just a day or two is going to really limit the lymphatic system. So I know one time when my middle son had viral pneumonia and he had a martial arts tournament 10 days later, I had him jumping and getting up every 20 minutes, or excuse me, 3 times a day, and we'd have him do 20 jumping jacks 3 times a day to get the lymphatic system to move. Now, we used to do these when we were in school, and you see the kids doing them when they do have PE classes, and it's just a standard jumping jack. What it does is we're moving our upper arms, but we're also moving our lower extremities to where we're bouncing. We're getting a bouncing motion. So if we do a good walk, we'll get the bouncing motion on the lower extremities, but flapping the wings, believe it or not, pumps this out. So for example, if you're doing that nice little glider or the ski machine or the elliptical, and you're doing this kind of motion and you're moving up and down, that's an excellent way. If you have a trampoline and you're jumping up and down to move, that will move lymphatic. Otherwise, the good old jumping jacks, or just moving your arms, or if you're a female, holding the boobies and jumping up and down 3 times a day, 20 repetitions, should help aid and abet your body's getting rid of any infection. Thank you very much. Next, we're going to be moving on to the research portion of our show. Hi, welcome to the research portion of our show, and with us today is Ralph Turchiano.
Thank you for that intro. Now, the first trivia question we'll lead off with is, what is the most powerful fruit known today to prevent osteoporosis? It is recently discovered, out of all the fruits that are out there, it is an incredibly powerful tool in prevention of osteoporosis. We'll discover that towards the end. All right, now off to this, vitamin A. While the United States is practically trying to reduce vitamin A in people's diets, for what reasons I honestly have no clue, the rest of the world is now trying to promote vitamin A. Why? Well, this article promoted in the British Medical Journal in regards to children. And to lead off, what they said is the researchers argue that the effectiveness of vitamin A, a supplementation, is now so well established that further clinical trials in vitamin A would now be unethical. And they urge policymakers to provide supplements for all children at risk of deficiency. Now, originally this was designed towards lower to middle income countries, but all because you're in a country like ours, the United States, that has abundance of calories, does not mean you're getting an abundance of nutrients, as we discovered with vitamin D. Now, they also said, too, the World Health Organization estimates that 190 million children under the age of 5 may be vitamin A deficient. Now, we're only looking at third world countries, not industrialized countries. But despite widespread efforts, the vitamin A programs do not reach all the children who can benefit. Ironically, vaccinations do, but the vitamin A doesn't. Nutrients first, vaccines second. If you got no food, your immune system's not going to do much good, regardless of how often you're vaccinated. And the reason for that is this. They said they found that vitamin A supplements reduce child mortality. Ready for this? To reduce all child mortality by 24%. Name any vaccine that does that. In low and middle income countries, it also reduced mortality and disability by preventing measles. This is not what I'm saying. This is what's in the British Medical Journal and the World Health Organization. Yes, they said vitamin A prevents measles. So if you have 190 million children deficient in it, of course you may have measles epidemics. Because why? They're not getting the ability, the nutritional ability to defend themselves against a very common disease which was never considered fatal in a well-industrialized country prior. Diarrhea and vision problems, including night blindness. The authors say if the risk of death for 190 million vitamin A deficient children were reduced by 24%, over 600,000 lives would be saved each year, and 20 million disability-adjusted life years would be gained. That's something you may want to consider, Bill Gates, instead of just trying to inject people instead of feeding people. All right, now is this. Caffeine. I know there's a lot of controversy in regards to caffeine being positive and negative, but the studies do come out in favor of caffeine quite a bit. And this time it does in regards to skin cancer. This is a Rutgers study that came out of. Caffeine directly applied to the skin, they discovered, may help prevent damaging UV light from causing skin cancer. But they also said, too, prior research indicated that mice who were fed caffeinated water and exposed to lamps that generate UVB radiation that damaged the DNA in their skin cells were able to kill off a greater percentage of badly damaged cells and reduce the risk of cells becoming cancerous. Keep that in mind. Caffeine seems to have a lot of benefit with pre-cancer, not once cancer is established. Although it is known that coffee drinking is associated with the decreased risk of non-melanoma skin cancer, there now needs to be studies to determine whether topical caffeine inhibits sunlight-induced damage to sunlight-induced skin cancer, so to say. The results, this is what the results were, of genetically modified mice developed tumors more slowly than unmodified mice. They had 69% fewer tumors than the non-coffee drinking mice, and developed 4 times fewer invasive tumors. Although multiple human epidemiologic studies link caffeinated beverage intake with significant decreases in several types of cancer, including skin cancer, just how and why coffee protects against skin cancer is still unknown. Something to think about if you have a history of skin cancer or concerned about it. Caffeine may be a powerful tool, and if they come out with a sunscreen with caffeine in it, it may be more powerful so you don't have to worry about drinking it just in case you're sensitive to it. Now, talking about cancer again. Another powerful spice seems to be making the news, and this time in regards to liver cancer. This has to do with a very well-known spice called saffron. Very common, non-toxic, hasn't messed with many people, not a lot of side effects known. And one thing probably that cannot be banned by places like the European Union and other elements like that. All right, this was printed in the September issue of Hepatology, a journal published by Wiley Blackwell. They said, quote, in regards to saffron, prior studies have shown that saffron, a naturally derived plant product, not a drug, possesses antioxidant, anti-cancer, and anti-inflammatory properties. Saffron is a commonly used spice, adding flavor to both color to foods, and also color to foods, and a possible cancer-fighting substance that is readily available. So I don't think it would hurt too much if someone's concerned about liver cancer, they add about a little saffron in their diet. I don't think their oncologists would mind so much, considering there's a lot worse things in food. They also said this. Are you ready for this? Results show saffron significantly reduce the number and the incidence of liver nodules, with animals receiving the highest dose of saffron showing complete inhibition of hepatic nodules. Complete inhibition from saffron. So basically, the research needs to go on to what dose is the most effective before you get the law of limiting returns on it. Saffron seems to be much more effective than a lot of chemo drugs for liver cancer. So if anybody should be researching anything, saffron should be the next thing to be researched. Not a big patent item, not a lot of money in it, but you know what? Looks like it kicks butt. Now to another herb, amazingly, which is commonly available, that's been used for spice all around the world again, and one that can't be banned by other authorities. Coriander oil. Now how this works is interesting. Coriander oil is found to be extremely beneficial against a broad range of harmful bacteria. Ironically, used as a food spice, probably one of the most common food spices used around the world. And this was published in a journal of medical microbiology. Again, these are published studies. Of the tested strains, all showed reduced growth, especially of bacteria. What they tested against was E. coli, Salmonella, Bacillus, and of course, methicillin-resistant Staphylococcus or MRSA. All showed reduced growth, and most were killed by just a solution of 1.6% coriander oil. That was it. Not a lot, just a little. Probably about the exact same amount you'd find in most of your food spices that used to occur naturally in our diet. Coriander oil is an aromatic plant widely used in Mediterranean cuisine. Coriander oil is one of the 20 most used essential oils in the world and is already used as a food additive. Coriander oil is produced from the seeds of coriander plant, of course, and the numerous health benefits have been associated with use of this herb over the centuries. These include pain relief, ease of cramps, convulsions, a cure of nausea, aid of digestion, and a treatment of fungal infections. The results indicate that coriander oil, this is how it works, keep this in mind, coriander oil damages the membrane surrounding the bacterial cell, disrupts the barrier between the cell and its environment, and inhibits the essential process, including respiration, which ultimately leads to the death of the bacterial cell. It says, we envisage, this is their words, not mine, the use of coriander in clinical drugs in the form of lotions, mouth rinses, and even pills to fight multi-drug resistant bacterial infections that otherwise could not be treated. Simple, everyday coriander oil, an answer to this tolerance to antibiotics and antibiotic-resistant diseases may have been under our nose for hundreds of years. Kind of makes you wonder if our ancestors didn't have a heads up on what was out there. All right, now we go back to the pharmaceutical industry. They took a look at the pharmaceutical journals, and this is what they discovered. Of 192 pharmaceutical advertisements in biomedical journals like the Lancet, British Medical Journal, and places like that, guess how many of the 192 were actually compliant with the FDA regulations? Of the 192, only 18% were compliant. And this study was published in the Journal of Public Library of Science, the PLOS-1. And interesting enough, 57.8% of the advertisements did not quantify serious risks, and 48% did not have verifiable references, meaning they could have made them up. There's no way to check out one way or the other. All right, back to the trivia question. Which fruit is an incredibly powerful ally in regards to osteoporosis? This was done by Florida State University, and ironically, is plums. They studied it for over 12 months. The group that consumed dried plums had significantly higher bone mineral density in moisture studies, especially the forearm test and the spine, with the groups that ate dried apples or other fruits. It says this was part and due because the plums have the ability to suppress the rate of bone reabsorption and the breakdown of bone, which tends to exceed the rate of new bone growth as people age. Well, I believe that's it, and thank you very much.
Thank you very much, Ralph. Once again, do your research. Take a look at our website, youtube.com/VHFILM, and as we post the shows 2 weeks after we film them. Thank you very much.